Okay, now we're going to talk about major directional terms. These are really important. We're going to use these throughout the semester as well as in 202. So please, please pay particular attention to these. Make sure you learn them. You'll also end up using these in any kind of allied health that you go into. They are applicable throughout the disciplines. All right, so when we use these directional terms, we're either going to use it in the name of a structure or to describe the location of a structure or an injury or an abnormality or pain or what have you. So to give you a better idea, let's talk about a couple of them. When we use the term dorsal, it's interchangeable with the term posterior. And what we mean by that is that it's toward the back of the body. So when you're scratching your back, that is the most dorsal or posterior part of you. Okay, when we're talking about ventral or anterior, it's going toward the front of the body. So if you're kind of scratching your chest, that's in the front of your body. Okay, so here are a couple of examples. So in this image on the top right, you'll notice that the heart is behind the sternum. So basically we would say that the heart is posterior to the sternum. We don't say behind, we say posterior to. Or if we say that the sternum is in front of the heart, we could also say the sternum is anterior to the heart. All right. Another way that we would use this is in describing certain, again, parts of the body. So in the knee, we have different ligaments. You probably have all heard of the ACL ligament. That stands for anterior cruciate ligament. And here in this knee joint, it's located right here, right underneath the patella, is the anterior cruciate ligament. And then behind it is a posterior cruciate ligament. We'll talk about things going toward the midline. You have basically, the midline is basically an imaginary line that goes right down the middle of you that splits you into equal left and right halves. So anything that goes toward that invisible midline is going medial. If we're going away from that, so like toward your shoulders, toward the outside of you, toward the sides essentially, away from the midline, that is considered lateral. So for example, if you remember proper anatomical position, right, standing upright, palms facing outward, the thumbs are lateral to the pinkies. They are to the sides. Okay, conversely, the pinkies are medial to the thumbs. They're closer to that imaginary line. Okay. Another example would be, again, in the knee, different ligaments. So if we're looking, so here we're looking at this knee joint. This is head on. This is an anterior portion of this knee toward the midline. So this would be like where your legs would come together or your knees would come together. You have a ligament. This is called the medial collateral ligament. You also have one that's on the outside of your knee that is called the lateral collateral ligament. When something is proximal, it is nearer the attachment of a limb to a trunk. Distal is exactly the opposite. It's further away from the attachment of a limb to a trunk. So when we're talking about proximal and distal, we're really refining these terms simply to your arms and legs. We do not say, well, we don't say superior or inferior in the arms and legs. You'll see those terms in a second. What we're going to say is proximal distal. Okay, so we reserve that for arms and legs only. We wouldn't use those terms on a torso either. Okay, so what we would say is that the hand is distal to the arm. Remember, the arm is that part where, like, right up by your biceps muscle, or the arm is proximal to the hand. Okay, in this image, you're looking at a humerus, so this would be part of the arm, and hopefully you can see in this upper part of the humerus, it looks like there's a notch taken out of it. And in fact, right up in here. So this is a closer to the attachment site. So this is actually a cyst, bone cyst that this individual had. It would be at the proximal end of the humerus is what you would consider it. If the damage was down at the distal end of the humerus, it would be down here somewhere. Okay, the epiphysis, this term in example 2, the epiphysis is just a fancy way of saying the end of a bone. Okay, so an epiphysis is just the end of a bone. So this, again, where it's attaching to your shoulder, would be the proximal epiphysis of the humerus. And then down here, where it's by your elbow, this would be the distal epiphysis of the humerus. So I mentioned these just a second ago, superior and inferior. If we're talking about something toward the head or the upper part of the structure, that's considered superior. If it's away from the head or the lower part of the structure, we call that inferior. Again, when we're using these terms superior and inferior, what we're going to be talking about is on the torso. In limbs, we talk proximal, distal. We don't use superior and inferior. Okay. So an example is that your heart, which is in your chest, is superior to the liver, right? It's above the liver. It's closer to the head. Or you can say it conversely, the liver is inferior or below the heart. In this bone here, what you see, this is actually a vertebra. It's a thoracic vertebra, so one's in your chest. You have what are known as superior and inferior articular facets. So an articulation, this term right here, is a very fancy way to say joint. So basically, whenever you see the term articulation, it's simply meaning a joint where two bones come together. And excuse my slow writing. Okay. So where two of these vertebrae will come together, there's a superior articular facet up here up top. And then you'll also have one at the bottom down here, that sort of white area. That is the inferior articular facet. So again, the one that's inferior is below, the one that is superior is on top. You may sometimes see these terms. We won't use them very much in this class, but just so you are aware of them. Ipsilateral means that it's on the same side of the body as another structure. Contralateral means that it's on the opposite side. Okay, so if we take a look at this, what we see here is that the gallbladder, this green right here, the gallbladder, is on the same side as the ascending colon, which is this part right here. Okay, so they're on the same side of the body. Contralateral would mean that they're on opposite sides. So if this was the ascending colon here on the right, the descending colon is here on the left. It's on the opposite side of the body. Sometimes we'll use the terms superficial versus deep. Sometimes it's not necessarily correct to say anterior versus posterior. So sometimes some structures are more superficial than others or closer to the surface, some are deep. Really, we'll use these terms more of when we're talking about, say, muscles. Some muscles are very superficial, some blood vessels are very superficial, others are more deep. They're further away from the surface of the body. It would take a very large incision or very deep incision to be able to see them. Okay. Similarly, you may have an injury that's very superficial. It's just a scratch on the surface of your skin, or one that is very deep, like a, I don't know, like a stab wound or something like that.